Hi, my name is PSYS, and I will be going over the DSM-5 criteria for bulimia nervosa. And now, if you'll follow me to slide 1, we'll begin. So, one of the first points made on this slide is that for the DSM-5 diagnosis criteria for bulimia nervosa, a person has recurrent episodes of binge eating. Now, in this case, the word binge means to have two characteristics of this disorder. Now, following that point, it goes to recurrent, inappropriate, compensatory behaviors to prevent weight gain, which is then followed by body shape and weight are extremely important for self-evaluation for a person who has bulimia nervosa. Now, body weight and the body shape will be mentioned a lot throughout this part of the presentation because it is a key component to this disorder. Bulimia nervosa is an eating disorder. And people develop this disorder by trying to keep their weight in check. And that doesn't mean that this person is overweight or weighs a few more pounds than what they feel like they should. It doesn't matter if the person is overweight, at a normal weight, or is even underweight. This person is using these techniques in order to control their weight because they see themselves as being at an unacceptable weight. They don't feel that they look good and they don't feel confident at the weight that they currently are at. So the next is going to ratings. Now the ratings are your usual mild, moderate, severe, and extreme. So a person who has mild ratings experience and show 1 to 3 compensatory behaviors a week. So they do it 1 to 3 times a week. A person who is moderate falls and has these behaviors 4 to 7 times a week. Severe goes from 8 to 13, and a person who has an extreme rating, it has 14 or more. Now, compensatory behavior is mentioned a lot throughout this slide in particular. These are behaviors that a person exhibits and do that help them get classified and fall under the bulimia nervosa disorder. So these behaviors include vomiting, they include fasting, and they also include excessive exercising. Exercise is a good thing, but exercising too much is possible. Fasting is when a person doesn't eat. They just don't eat food. And then obviously vomiting, we all know what vomiting is. The biggest thing to take away from this slide, and really just this disorder in general, is that body image is everything. That is the entire reason why they develop, or the entire road, so to speak, that led them to developing this said eating disorder. So now, if you'll follow me to slide 2, we'll go into the differences between the DSM-4 and 5. So there were 2 main differences that I found between DSM-4 and DSM-5. The first one I listed here on the slide. So for DSM-4, it states that binge eating and inappropriate compensatory behaviors occur on average at least twice a week for 3 months. Now this changes when we move over to DSM-5, where it states that binge eating and inappropriate compensatory behaviors occur on average once a week for 3 months. So it went down from twice a week to once a week. It's also very important to note that it is over a 3-month span. So a person has to exhibit these behaviors regularly for a 3-month span period in order to be diagnosed with this eating disorder. The second difference that I found was the classification. that these eating disorders were listed under. If you look at DSM-4, it just has a broad umbrella of classifying as eating disorders, whereas once you shift to DSM-5, it goes from the broad umbrella of eating disorders to feeding and eating disorders. So that was another thing that I found as a difference between these two DSM criterias. Then if you'll follow me to slide 3, we go into the similarities in the DSMs. So the big ones are that the disturbance does not occur exclusively during episodes of bulimia nervosa, which just means that a person can experience and do these behaviors and show these symptoms even when they are no longer classified as having the bulimia disorder. The second one is self-evaluation is unjustifiably influenced by body weight and body shape, which once again comes into play that the biggest thing that people who have this disorder worry about is how they look. And it's not like you can tell them that, hey, you look fine, everything's good. They themselves have it in their minds that the weight that they are at either is too much or is just right, and they can't afford to lose or gain any weight. Another thing that is similar between the two DSMs is that the recurrent episodes of binge eating paired with the recurrent inappropriate compensatory behaviors that prevent weight gaining, which you should sound familiar because that was the criteria listed in slide 1. Then we move on to slide 4, which is questions. There are a lot of questions that surround bulimia nervosa, and some of these that get asked are, what causes a person to have bulimia nervosa? Stress is one of the biggest triggers for a person to start down the road to having really almost any disorder, but in particular eating disorders. Stress is one of the biggest triggers that the person can have, whether it be stress of them gaining weight, stress of them, just not feeling like their body shape is the way that they want it to be. It's all about how they perceive themselves, but they're not looking at like an overall picture. They're looking specifically at how their body is shaped and how much they weigh at that particular time. So another question that is asked is, when does this disorder take place? This disorder is a normally private thing. It takes place in a private setting mainly because the person, the most common way a person, is diagnosed or exhibits the behaviors is through vomiting. So they eat, take this for example, they'll eat an absurd amount of food on the clock every 2 hours. So let's say I have a dinner, or it's 6 o'clock. Once 8 o'clock hits, I'm going to eat enough for 3 people. And then I may go and I throw up. And then that I got rid of that food, but I still ate. And then once 10 o'clock hits, I hope I said 8 o'clock first. Once 10 o'clock hits, I eat again the same amount. I wait a little bit, then I go and I throw up. And sometimes they don't even wait. They eat and then immediately go and relieve themselves of the food that they just consumed, and so that the food doesn't have time to fully digest and travel anywhere to absorb any fats that the food may have. So being done in private is why this disorder eating disorders in general are kind of hard to spot unless a person goes through like a drastic weight loss. It's because it's done in private. It's not being done in front of people, and normally they'll give excuses like, oh, I ate before I came, so I'm not that hungry, or things like that kind of gets them out of either eating at that set time, and so on and so forth. Another thing is that your care providers sometimes may expect or suspect that, that you or the person who in question has an eating disorder, specifically bulimia, but this can also cross lines for anorexia because they are very similar, and there's like the thin line that dances between them that separates the two. So some questions that a care provider may ask go along the lines of, what are, your eating habits? Are you eating a lot? Are you not eating enough? Just try to get a feel of how your meal plans are planned out. Another question they may ask is, how long have you been worried about your weight? Because some people do come out and say, I don't like the weight that I'm at. I'm nervous about how much I weigh. I'm nervous about gaining weight. So then that'll prompt them to be like, how long have you been worried about this? Because that gives them the time frame of, has it been 3 months or more or less? And then they can go about pointing you in the right direction to get help that you may need. Another question that they ask is, have you found any other ways to lose weight? So this is kind of hinting at, have you, found that if you exercise twice a day for 2 hours for each session, and that's how you're staying, at the weight that you're at, and that's how you're ensuring that you aren't gaining any weight. It's pretty much just their way of being like, hey, what are you doing? And are you exhibiting any of these behaviors that fall under any of these DSM-5 criteria for this said eating disorder? Sometimes, depending on how drastic it is, they may ask for a blood or urine sample to do tests on, just like how your body is health-wise. And they may also ask about your family history. They may ask, are there any family members in particular who have had a history of eating disorders, or if they've had the specific bulimia disorder. Genetics plays a big part in a lot of disorders. Eating disorders is, different. So finding out if a person has a family member or a family history of eating disorders, it will help identify and kind of give a pathway to diagnose the person on whether they have bulimia nervosa or not. And that is everything I have for you guys. I hope you enjoy the slides, and I hope that you have a good understanding of the DSM-5 criteria for bulimia nervosa and how it differs from past criteria. Thank you.